Hello, my name is Jeff Rogers. I'm the Director of Ozone and Medical Breakthrough, with a question mark at the end. That question mark is because for many people the jury is still out on this treatment. I first learned about ozone therapy from my father, who was the first doctor in Canada to use the treatment. And he's received various warnings from the College of Physicians and Surgeons, but still refers to some of the experiences he's had with patients as some of the high points of his medical career. A man with a diabetic ulcer, so bad that his leg was scheduled to be amputated, came to my father, and using ozone, bagging the limb, helped save the man's leg from amputation. I was in film school at the time when I first started this project, and I was a little skeptical, as I think most people are when they hear about it. How could something with such big claims being made about it be so good and yet not hear about it? And it was only after traveling and speaking with the top scientists and doctors in the field that I realized that this is a very important treatment and one that has been very seriously overlooked by the medical community and by government authorities. In almost every area of medicine, there is room for ozone to help. Even in areas such as the use of chemotherapy and radiation, ozone can be used to reduce the side effects from these sometimes very toxic treatments. After traveling to Russia and Cuba, where ozone therapy is legal now nationally and available in many of the major hospitals, and after traveling to Germany and all through Europe, I have come to the realization that there is a huge imbalance of information on the subject as it pertains to its use in North America. Part of the problem is that the media coverage has been almost non-existent, and the coverage that we have had on the subject has been slanted and biased towards coverage of people making inappropriate claims, unsubstantiated claims, and claims that are being made by non-medical professionals. Major media is supported significantly by their advertisers, and the multinational pharmaceutical companies are some of the largest advertisers on earth. The money we're talking about is enormous, and that can buy lobbyists in Washington and can help tilt the playing field to the advantage of pharmaceutical companies. Substances and treatments that don't necessarily fit that agenda are not going to get covered, or worse still, actually get negative media coverage. Well, today it's kind of in a gray zone. The Food and Drug Administration still refers to it as unproven and fraudulent. And so it's not officially approved by the US government, but naturopathic associations in Canada and the United States now certify their members in the use of it. And you can find ozone therapists in just about every major city in North America. Why are the Canadian and US governments not investigating this therapy further? Well, there's an issue of money. It costs a lot of money to research these things, and we have now kind of taken it for granted that this research is going to be done by the major pharmaceuticals. If you can't patent a natural gas, how are you going to be able to monopolize a treatment in order to be able to make money from it? And that is what ozone faces. In the meantime, grassroots usage has spread, and with it comes potential dangers of people using equipment that they're not familiar with, using processes that they're not used to, and there's inherent risks with that. Coming across something that seems to have benefit in just about every area of medicine, and it gives people the opportunity to dismiss ozone as quackery, as a tonic. And the irony is that it's that very ability for ozone to potentially benefit in so many areas that it makes it one of the biggest breakthroughs in modern medicine. I found it more than a little ironic that in Cuba, a country with very little resources, has actually done some of the most important research on the subject in ozone. And these are doctors that are paid very little to do their work. And they are not being motivated clearly by money, but they're being motivated to do good science. I think it's time that the international community look into their research and the research that's done in other countries, Italy, in Russia, Germany, France, and try to replicate their results. Sure, maybe Russia and Cuba don't have the same amount of research dollars as Canada and the United States, but that should not deny the results that they're getting. They are doing controlled studies. They are doing double-blind studies. They are using control groups, and the results speak for themselves. Major reductions in disease in a whole spectrum of areas of medicine. All of this information is available for free through the internet at PubMed, which is the National Library of Medicine's internet database. I started this project many years ago, and it's been a struggle sometimes to get it completed. Some of the major funding organizations were not interested, and it was only through the support of my parents and some very generous private contributors that I was able to complete this project. The first version of it was completed in '93 and went on to be selected by the Academy of Motion Picture Arts and Sciences in Los Angeles as one of the outstanding documentaries of the year. Despite winning at various international film festivals, that first version was refused for broadcast in more than 23 countries. And so I have tried to make a version that may be more acceptable for the international broadcasters. 4 different times I went to Washington, D.C. looking for answers as to why the U.S. government and the National Institutes of Health in particular appear to be ignoring this medical treatment. Because we're talking about a treatment here that appears to have benefits for almost every area of medicine. So far, the only conclusion that the U.S. government has reached is that ozone therapy is fraudulent. And yet, the FDA and the NIH have evidence in their files that say the contrary. It's time to get on it and establish regulations, guidelines, parameters, and of course, do more research.